Today is 17 September 2019. We mark the first annual World Patient Safety Day. As we commemorate the first World Patient Safety Day, let us start with the WHO definition of patient safety. It is defined as the absence of preventable harm to a patient and the reduction of risk of unnecessary harm associated with the health care to an acceptable minimum. The WHO Regional Office for Africa recognizes and places high importance on patient safety to ensure that it has the rightful prominence within the healthcare in the region. Patient safety has been discussed by the member states during the 58th session of the WHO Regional Committee for Africa. Patient safety in African health services, issues and solutions. The members of the Regional Committee stressed that strong healthcare systems were necessary to address patient safety issues and the safety of healthcare workers. There are many challenges in strengthening health systems to ensure patient safety in the region. 1. There is a lack of national policies, strategies, standards, guidelines, and tools on safety healthcare practices, and ineffective implementation if they exist. Number 2, inadequate funding. Number 3, inadequate human resources for health. Weak healthcare delivery system with suboptimal infrastructure, poor management capacity, and under-equipped health facilities. And 4, ineffective mechanisms for forging strong partnerships to adequately involve patients and civil society in the improvement of patient safety. Half of the global disease burden from patient harm originates at primary and ambulatory care levels. The good news is that up to 80% of harm in these settings is preventable. For example, improving diagnosis, prescription and use of medicines, responsible for most detrimental errors, will significantly reduce the risk of them. Available evidence suggests that 134 million adverse events occur annually in hospitals, similar to our settings here in the African region. In low and middle income countries, 1 out of every 10 patients in health facilities acquire healthcare associated infection. More importantly, in developing countries, more than half of all infants housed in units for newborns suffer healthcare associated infections with a fatality rate of between 4 and 56%. In turn, while caring for the sick, healthcare workers are also exposed to risks such as tuberculosis, hepatitis, HIV/AIDS, and other infections. Efforts to improve the health facility environment, enhance practice of infection prevention and control, and adherence to standard operating procedures would go a long way in addressing this problem. We welcome the 72nd World Health Assembly Resolution 72/6 on global action on patient safety, which endorsed the establishment of this annual campaign. There is an urgent need to raise awareness and understanding of patient safety. We must galvanize actions towards safety systems, services, procedures, and practices in healthcare to eliminate harm to patients and to mitigate any risk of harm to patients. Patient safety is an essential component of healthcare that should be given immediate attention. The campaign brings all key stakeholders together, and allows providers, seekers, and managers of healthcare services to express solidarity and commitment to make healthcare safer. The fundamental principle to do no harm. The theme for the first World Patient Safety Day is patient safety, a global health priority, calling upon all to give patient safety high priority. It also calls for promotion of open communication, for learning from errors, and to emphasize the importance of patient safety, as well as increasing the voice of the patient. Hence the slogan, "Speak up for the patient, for patient safety." WHO is committed to support countries in determining status of patient safety, development and implementation of national policies, guidelines, and protocols for enhancing patient safety, as well as facilitating patient safety networks and partnerships. I call upon all stakeholders to make strong commitments, prioritize and take action, and support the implementation of strategies for ensuring patient safety, managing risks, and fostering supportive learning cultures. I encourage all to widely share information regarding observance of this first Patient Safety Day. Your involvement, support, enthusiasm,